Hi students, today let's discuss regarding labyrinthitis. First of all, the definition of labyrinthitis. It is an inflammation of labyrinth. Labyrinth means the inner ear. As we all know that there is divided into three parts, namely external ear, middle ear and internal ear. So labyrinthitis means it is an inflammation of the inner ear. Okay. So this is a picture of labyrinthitis. So here you can see in this circle, you can see that an inflamed labyrinth. So it consists of cochlea and related structures within the inner ear. Okay. Mainly, labyrinthitis is divided into three, such as circumscribed labyrinthitis, diffuse serous labyrinthitis, and diffuse suppurative labyrinthitis. So these are the main three classification of labyrinthitis: circumscribed, diffuse serous, and diffuse suppurative. First is circumscribed labyrinthitis. There is thinning or erosion of bony capsule of labyrinth, usually of the horizontal semicircular canal. So circumscribed labyrinthitis is mainly characterized by thinning or erosion of the bony capsules of labyrinthitis. As we all know that in the inner ear, there will be two forms of capsules that are present, such as bony labyrinth and membranous labyrinth, isn't it? So in case of circumscribed labyrinthitis, there will be erosion of bony labyrinthitis. The labyrinth will be happened, as well as there will be erosion can be happened at the horizontal semicircular canal. Semicircular canal will be having three layers or forms: horizontal, lateral. നമ്മൾ ഡിസ്കസ് ചെയ്തതാണ്. Okay. So അതില് horizontal semicircular canal ആ പോർഷനിലായിട്ടായിരിക്കും മെയിനായിട്ടും ഇറോഷൻ ഓഫ് ബോണി ക്യാപ്സും നടക്കുന്നത്. So this is a picture of the internal ear as well as the bony labyrinth and membranous labyrinth. Bony labyrinth എന്ന് പറഞ്ഞാൽ outer portion or covering portion of the internal ear ആണ്. So ഈ portion ഇതാണ് semicircular canal എന്ന് പറയുന്നത്. Okay, this is horizontal semicircular canal. Then posterior semicircular canal. And superior semicircular canal. Okay. Bony labyrinth എപ്പോഴും കവർ ചെയ്തിരിക്കുന്നത് ആ ഏരിയയിലായിരിക്കും. Then the etiology of circumscribed labyrinthitis. Chronic suppurative otitis media. It is the base. In short form, it can be called as CSOM. Okay, it is chronic suppurative otitis media with cholesteatoma. So the main reason for getting circumscribed labyrinthitis means it is CSM, that is chronic infection or pyogenic infection of the middle ear associated with the development of cholesteatoma. Cholesteatoma means it is an abnormal non-cancerous skin growth that can develop in the middle section of ear behind the eardrum. So cholesteatoma എന്ന് പറയുന്നത് non-cancerous skin growth ആണ്. Commonly നമ്മൾ middle ear കാണുന്നതാണ്. So it can be occurred as an association with middle ear infection. So it can be acted as a cause for getting circumscribed labyrinthitis. Next is neoplasms of middle ear or cancerous growth of the middle ear can be leading to the development of circumscribed labyrinthitis. And here reasons are erosion സംഭവിക്കാൻ chance ഉണ്ട്. Then surgical or accidental trauma to labyrinth. Suppose while doing any surgical procedures that can affect the part of labyrinth, that can be caused any surgical trauma to this part. So automatically it can injure as well as it can be leading to an infection. Okay. So this is a picture of otitis media. Okay, this is inflammation, fluid accumulations in the middle ear. Commonly in the middle ear there will be air will be filled within the middle ear, isn't it? So only in infection cases the middle ear is filled with fluid. Okay. So idana കാണാം. Separate otitis means this is pus collection. Suppurative is a pus formation, a pus collection. So this is pus collections within the middle ear. This is a picture of cholesteatoma. Cholesteatoma means it is a non-cancerous skin growth that can affect in the middle ear. So our cancer skin and non-cancerous skin growth automatically that part will be having an accumulation of this skin growth. Automatically that can be leading to a erosion of this bony capsule. Okay. Okay, ആദ്യം അതിൽ cyst ആയിട്ടായിരിക്കും ഫോം ചെയ്യുന്നത്. As the disease progresses, it can lead into even perforation. Colistioma state നമ്മൾ സീരിയസ് ആയിട്ട് എടുക്കേണ്ട ഒരു കണ്ടീഷൻ ആണ്. കാരണം അത് ട്രീറ്റ് ചെയ്തില്ലെങ്കിൽ ultimately the patient can develop deafness also. Okay. Then the clinical features of circumscribed labyrinthitis: vertigo, often induced by pressure on tragus, cleaning the ear while performing Valsalvia maneuver. Okay, the main complaint in the patient will be having a complaint to vertigo because the inner ear is mainly having a function of balancing, isn't it? So, a balance function affects the patient can develop vertigo. So automatically, often the patient in vertigo around. Even if you are trying to press on tragus of the external ear, patient may develop vertigo as well as while trying to clean the ear. Also, patient may develop vertigo while performing the Valsalva maneuver because Valsalva maneuver is a procedure. നമ്മൾ ബ്രീത്ത് നമ്മൾ ഹോൾഡ് ചെയ്തിട്ട് നമ്മളൊരു ബ്രീത്ത് നമ്മൾ ഹോൾഡ് ചെയ്ത് വെച്ചിട്ട് ഒരു എക്സ്ട്രീം ആയിട്ട് നമ്മൾ പ്രഷർ റിലീസ് ചെയ്യുന്ന ഒരു സിറ്റുവേഷൻ അല്ലെ. അത്രയും നമ്മൾ ബ്രീത്ത് ഹോൾഡ് ചെയ്തിട്ട് ഒരു automatically patient will develop a vertigo due to the changes in the pressure. Okay, the diagnostic evaluation first is fistula test. The fistula test is designed to elicit symptoms and signs of an abnormal connection between the labyrinth and surrounding spaces. I mean, the erosion സംഭവിക്കുമ്പോൾ automatically in the later stages there will be formation of an abnormal connection between this labyrinth with the surrounding spaces. And then number fistula it is an abnormal connection. So normally fistula test is negative. Normally normal ear particular fistula so labyrinthitis is a chronic stage in there will be a formation of fistula, then it will be positive. So this fistula test can be done under 2 stages. Okay. Clear this perilymphatic fistula that can be seen here. Okay. Actually, no connection okay. We abnormal connection forms due to the erosion of this bony capsule. Then the fistula test can be done by pressure on the tragus because the vertigo can be happened in case of while trying to apply the pressure on the tragus. So it can be used as a procedure to assess for fistula. Sudden inward pressure is applied on the tragus. This increases air pressure in the ear canal and stimulates the labyrinth. Patient will complain of vertigo. Okay, pressure on tragus. Fistula test ചെയ്യുന്ന ഒരു method ആണ് pressure on tragus എന്ന് പറയുന്നത്. നമ്മൾ tragus external part ഉള്ള earന്റെ നമ്മൾ tragus നമ്മൾ pressure apply ചെയ്യുമ്പോൾ automatically it can increase the pressure inside the ear canal. So that can be stimulate the labyrinth. Internal ear and stimulate automatically patient will get into the vertigo stage. Then nystagmus may also be induced with quick component towards the in-ear under test. Along with the vertigo, patient may be having a nystagmus. Nystagmus means involuntary eye movement. Okay. Then, so this is a picture of positive perilymph fistula test. ഇവിടെ നമ്മൾ tragus നമ്മൾ apply ചെയ്യും. This is tragus. Okay. External ear ഈ ഒരു പാർട്ടിനാണ് tragus എന്ന് പറയുന്നത്. ഇവിടെ നമ്മൾ pressure apply ചെയ്യുമ്പോൾ automatically patient will develop vertigo due to the increased pressure within the ear canal. Patient may develop this vertigo along with nystagmus. Okay. ഒരു പേഷ്യന്റിന് apply ചെയ്യുമ്പോൾ vertigo feel ചെയ്യുന്നത്. So that can be manifest during his phase, so it can be considered as a positive perilymph fistula test. Then serous speculum. It is another method through which we can assess for the fistula test. When positive pressure is applied to ear canal, patient complains of vertigo usually with nystagmus. The quick component of nystagmus would be toward the affected ear. Serous speculum use ചെയ്തിട്ട് നമുക്ക് വേണമെങ്കിൽ but fistula test assess ചെയ്യാവുന്നതാണ്. So in this we are trying to exert a positive pressure within the ear canal. In that procedure, patient will develop vertigo associated with misdiagnosis. So in case of misdiagnosis, patient will be having a component towards the affected area. ഏത് ഇയറിലേക്കാണ് പേഷ്യന്റിന് കംപ്ലൈന്റ് ഉള്ളത് ആ സൈഡിലുണ്ടായിരിക്കും misdiagnosed patient കാണിക്കുന്നത്. Okay. So this is serious speculum in which you can see that there will be an earpiece will be there and a cuff will be there. Through that we can apply a pressure. Okay, ഒരു cuff ഉണ്ട് അത് വെച്ച് pressure നമ്മൾ exert ചെയ്ത് കൊടുക്കാവുന്നതാണ്. This is the basis of this test, which may induce misdiagnosis, producing changes in the external canal, which are then transmitted to labrum, stimulation of labrum, produces misdiagnosis and vertigo. So this is suppose ഈ ഒരു part നമ്മൾ earലേക്ക് attach ചെയ്യുന്നു, then cuff വെച്ചിട്ട് നമ്മൾ pressure apply ചെയ്യുന്നു. Okay. Then positive fistula test. Positive fistula test ആകുമ്പോഴത്തേനും there will be ഇതുണ്ട്. This is fistula formation. So patient will develop vertigo associated with misdiagnosis. Then treatment. How we can treat a circumscribed labyrinthitis? Mastoid exploration. We can explorate the mastoid so that we can release this pressure balance and we can maintain or we can reduce this labyrinthitis. Okay. Then systemic antibiotic therapy should be instituted before and after operation to prevent spread of infection to labyrinth. Because we also discussed in the surgical or accidental trauma to the labyrinth can be leading to the development of circumscribed labyrinthitis. Isn't it? So, upon the surgical procedure, we should be careful while doing a surgical procedure to these structures. So, before and after the operation or surgical management to the labyrinth, we can start with a prescribed dose of antibiotics. Okay. The next is diffuse serous labyrinthitis. So till now we were discussing regarding one of the most important labyrinthitis. There was circumscribed labyrinthitis. Next is diffuse serous labyrinthitis. It is diffuse intralabyrinthine inflammation without pus formation. It is a form of labyrinthitis, but there is no production of pus. There will be intralabyrinthine inflammations will be happening there, but there is no pus production. It is a reversible condition if treated early. Still, both circumscribed as well as diffused labyrinthitis can be reversible in nature. If you started the treatment with the early stage, we can manage the condition as well as we can reverse this condition. Okay. Then the etiology for diffuse serous labyrinthitis. Pre-existing circumscribed labyrinthitis associated with chronic medullary separation or called steatoma. Once patient in circumscribed labyrinthitis ഉണ്ട് നമ്മൾ വേണ്ട രീതിയിൽ ട്രീറ്റ് ചെയ്തിട്ടില്ലെങ്കിൽ the next stage along with medullary infections അല്ലെങ്കിൽ colic steatoma ഒക്കെ ആയിട്ടും പേഷ്യന്റിനെ ട്രീറ്റ് ചെയ്തിട്ടില്ല എന്നുണ്ടെങ്കിൽ next stage patient diffuse serous labyrinthitis വരാം. Then acute infections of the medullary will be leading to the diffuse serous labyrinthitis. It can follow stapedectomy, stapes or fenestration procedure. അപ്പം അത്രയും കാര്യങ്ങളാണ് മെയിനായിട്ടും diffuse serous labyrinthitis reason. Then how we can manage this condition? Medical and surgical. എപ്പോഴും ഇതിന് diagnostic procedure അല്ലെങ്കിൽ clinical features same as that of circumscribed labyrinthitis. Okay, then management is patient is put to bed, head immobilized with affected ear. എപ്പോഴും നമ്മൾ പേഷ്യന്റിനെ നമ്മൾ comfortable at the then head should be immobilized with the affected ear above. Then antibacterial therapy can be started. If the patient has complaints of medullary infections or colic steatoma, it can be managed with a spectrum of antibiotics. Okay. To treat medullary infection, the labyrinthine sedatives will be available. Example, prochlorperazine or Stemetil or dimenhydrinate or Tamami. So these are the labyrinthine sedatives through that we can reduce the symptoms of discomfort. Okay, then surgical management can be done. Laryngotomy means it can be done if labyrinthitis has followed acute otitis media and the drum is bulging. അതായത് laryngotomy എന്ന് പറഞ്ഞാൽ it is a procedure in which we are trying to make an incision in the tympanic membrane. Okay, laryngotomy means we are trying to put an incision. എപ്പോഴും അങ്ങനത്തെ പ്രഷർ കൂടിയിട്ടാണ് പേഷ്യന്റ് കംപ്ലൈന്റ് വരുന്നത്. സോ ഇയർ ബൾജ് ചെയ്യുകയാണ് അല്ലെങ്കിൽ അക്യൂട്ട് ഓട്ടൈറ്റിസ് മീഡിയ വരുമ്പോഴത്തേന് ഫുൾ പസ് ഫോർമേഷൻസ് ആയിരിക്കും. അങ്ങനെ വരുമ്പോൾ വീണ്ടും അത് ടിമ്പാനി മെംബ്രെയിനിൽ അത് പെർഫറേഷൻസിന് കാരണമാവും. സോ അത് ആ പസ് നമുക്ക് റിമൂവ് ചെയ്ത് കളയാൻ പ്രഷർ റിലീസ് ചെയ്യാൻ വേണ്ടി നമുക്ക് ചെയ്യാവുന്നതാണ് Labyrinthitis എന്ന് പറയും. Okay. Then cortical mastoidectomy can be done in acute mastoiditis. Acute mastoiditis along with cholecystectomy we can manage with cortical mastoidectomy, then modified radical mastoidectomy in chronic medullary infections or cholecystectomy. എപ്പോഴും medullary infectionsന്റെ ഒരു കോംപ്ലിക്കേഷൻ ആയിട്ടായിരിക്കും mastoiditis വരുന്നത്. സോ ആ കണ്ടീഷൻസിൽ നമുക്ക് എയർ സെൽസ് റിമൂവ് ചെയ്ത് കളയുമ്പോൾ we can manage this condition. So these are the methods through which we can manage labyrinthitis, diffuse form of labyrinthitis. Okay, so this is a picture of meningotomy. Meningotomy means it's a perforation, or we are trying to make an artificial opening in the tympanic membrane or eardrum. So adile eardrum bulge on due to pus accumulation we can drain out through this incision. Okay, so this is another picture. That mastoid infections were in the patient. Chronic stage the patient may be having a acute mastoiditis. Okay, mastoiditis were in the patient. So this mastoid region, so patient will develop a bulge. This is the mastoid region. Okay, so this is the mastoid and this is the infection. So this area will be swollen. That can be seen in this picture. Okay. Then cortical mastoidectomy. How we can remove this air cells from the ear? Mastoid air cells are removed. Due to the chronic infections in the later stage of the labyrinthitis, we can manage with cortical mastoidectomy. Okay, so through that we can make an incision in this area. There is a mastoid area. Through that, mastoid air cells can be exposed and it can be removed. Okay, so this is a picture of cholecystectomy that will be present in the middle ear. So along with the mastoid cells, we can try to remove this cholecystectomy. Okay, this is the initial picture and this is the later picture. So this is middle ear. So cholecystectomy and bone can be removed. Okay, to manage this condition. The last stage is diffuse suppurative labyrinthitis. It is a complicated stage of labyrinthitis. It is a diffuse pyogenic infection of the labyrinth with permanent loss of vestibular and cochlear function. So when we are discussing regarding the two forms of labyrinthitis, that is circumscribed and diffuse serous labyrinthitis, there will be cochlear as well as vestibular functions are patent. Okay, പക്ഷേ diffuse suppurative labyrinthitis. Suppurative means the term itself denotes that there will be pus formation. So it's a diffuse pyogenic infection of the labyrinth. Pus formations are a characteristic feature. So ultimately, patient may develop into a permanent loss of vestibular as well as cochlear function. So that patient can affect the balancing function as well as the hearing can be impaired in this stage. The etiology is it usually follows serous labyrinthitis. So first നമുക്ക് കാണാൻ പറ്റും circumscribed labyrinthitis ട്രീറ്റ് ചെയ്തില്ല എന്നുണ്ടെങ്കിൽ diffuse serous-ലേക്ക് പോകും. Then it can be leading to diffuse suppurative. Okay, then not treated well. എപ്പോഴും ഇങ്ങനെയായിരിക്കും transition ഉണ്ടാകും. Okay, so it usually follows serous labyrinthitis. Pathogenic organisms entering through a pathological or surgical procedure. Suppose if you are trying to make a surgical procedure in the inner ear, if it is done under non-aseptic conditions, it can develop or it can act as a portal of entry for many pathogenic organisms and it can be leading to this condition. Okay. The clinical features of diffuse suppurative labyrinthitis include severe vertigo because the vestibular function is completely lost in this condition, and nausea, vomiting, spontaneous misdiagnosed with a quick component towards the healthy side. So patient may be having a complaint of vertigo associated with nausea and vomiting. Vomiting can be associated with misdiagnosis. Here it can be towards the healthy side. Okay, then total hearing loss due to the complete involvement of cochlea. The treatment is same as for serous labyrinthitis. We can manage with antibiotic therapy. And with the pyogenic organisms, according to the organism, we can manage with antibiotic therapy. Then labyrinthotomy. Labyrinthotomy means it's a drainage of labyrinth to remove pus from the labyrinth. It's required if infection leading to intracranial complications such as meningitis or brain attack. ഇത് നമ്മൾ ശരിക്കും മാനേജ് ചെയ്തില്ലാന്നുണ്ടെങ്കിൽ കോംപ്ലിക്കേഷൻസ് കൂടും. Cranium, intracranial complications ആവും, like meningitis-ലേക്ക് പോകാം, അല്ലെങ്കിൽ brain abscess-ലേക്ക് പോകാം. So നമുക്ക് primary aim is to remove this pus formation, isn't it? So to remove this pus, you can maintain a drainage from the labyrinth. We can make an incision in the labyrinth. Through that, we can remove this collected pus. Okay. Then the medical management includes same as that of the serous, diffuse serous, labyrinthitis, antibacterial therapy, labyrinth sedatives can be given. Then meningotomy can also be performed. Okay, in surgical cases, called mastectomy, modified radical mastectomy. Along with that, we can perform what? Labyrinthotomy. Okay. So in this class, we had dealt regarding what is labyrinthitis, the definition, mainly three types: circumscribed, diffuse serous, and diffuse suppurative. And in each condition or in each stage, we had discussed regarding the etiology, the clinical features, as well as the management, along medical as well as surgical management we had discussed. So I hope you got an idea regarding this condition. So please go to this note, and if you have any doubt, you can ask me. Okay, thank you.